We know that there are a few issues with medicines in care homes. Patients often get prescribed excessive medicines, quite often inappropriate, sometimes unnecessary medicines. There's often lack of detailed review, and patients don't really get a say in the decisions made about medicines. The Shine 2012 project aimed to address some of these issues. Our objective was to optimise medicines in older care home residents whilst fully ensuring that they were involved in all decisions made about them. Using quality improvement methodology, we set out to develop a process to undertake complex medication reviews in care home residents. We wanted to develop a simple process, a pragmatic process that allowed the reviews to be undertaken, but also ensure that residents or their families or advocates could be fully involved in any decision. Our starting point was 3 questions. Does the medication have a purpose? Is it doing something like treating disease or managing symptoms or preventing disease? Is the medication safe? We had to ensure that we were doing no harm to our residents. And finally, are there any other medication that the patient should be taking? We know from research that if you're already taking lots of medicines, the chances are that you won't be prescribed medicines that you may need. The pharmacist undertook a detailed medication review, the findings of which was taken to a multidisciplinary team meeting comprising of the pharmacists, care home nurses, GPs, and where necessary other professionals like psychiatry of old age services, consultants, palliative care teams. The team discussed the medicines, came up with an action plan which was then taken to the patients, and the patients' views were then incorporated into this, and a joint decision was made on what to do next. The project was really successful, really pleased with it. We reviewed 422 residents, made over 1,300 interventions, and over the course of the year, through various measures, have shown that we really did improve quality of care for those residents. Our biggest intervention was to stop medicines. We stopped over 700 medicines in 2/3 of patients. The average number of medicines taken by these residents was 11, and we reduced that down to 9. This project was all about improving quality for patients, but by doing it we also showed that we released significant savings against the medicines budget, saving over £80,000 in a year. We know that by investing £1 in this project you can save over £2 from medicines. There were other efficiencies too. We showed a reduction in drug waste, so that's medicines going back to pharmacies to be destroyed. We also showed a significant reduction in the amount of time nurses spent giving medicines to patients, which is fantastic, which meant that they can now use that time to care for their patients. One of the biggest achievements we made was actually involving residents or their families in decisions about them. This was always going to be tricky given the set of patients we were dealing with, but I'm proud to say that 16% of our patients had the capacity and the willingness to be involved in decisions, and they actively got involved. For the remaining patients, we developed a framework where we spoke with their family or got formal advocates in to speak for them, so that any decisions made were made in the best interest for the patients. One of the biggest pieces of learning I personally got from this project was getting the team right, making sure that you involve the right people, get advice from the right people, and listen to that advice. We were lucky to have GPs, care homes, consultants, and a whole range of other stakeholders supporting us. For example, Age UK helping us with patient advocacy. Getting your team right will make your project work a lot more smoothly. If I were to do this again, I would treat it less like a project and more like service development and improvement. What would have been nice was for the project to have ended and then continue on using the resource that we had in the health economy, rather than what happened with our project is where the project ended and then we had to then write business cases for commissioners to approve. My proudest achievement for this project has been that we've given care home residents a voice and a say in the medicines that we take.